Medicare is a huge bureaucratic program with lots and lots of rules. Now, if we keep the rules, there's no problems. But if we are unaware of a rule or forget about a rule or absolutely miss a rule, then there could be problems. So in this video, I'm going to share with you a very important rule called the birthday rule that you need to be aware of and take advantage of if you can. I want to begin this video with just a quick reminder about the three insurance options that we have when we go on Medicare. The first one, of course, we can choose to do A and B only. Most people don't do this because of all the risk of having no additional insurance beyond A and B, but that's one option. The second option is to have A and B original Medicare with a supplemental plan to fill in those financial gaps to get rid of the risk that actually exists in the A and B system. The third option is to do a replacement plan called Medicare Advantage plans, which are also called C plans. So when we go on Medicare, we have to choose one of these three. So as we talk about the birthday rule, I want to make sure you understand that we are dealing with supplemental plans. All right. So this video is all about those people who choose option number 2, which means to stay in traditional Medicare, and they get a supplemental plan to fill in the financial gaps. Now, I want to clarify something just real quickly, and that's this. The birthday rule, notice what I'm saying here, does not apply when we first buy a supplemental plan. So let me explain. Today, I'm shooting this video. It is 4/30 of 2024. Okay, let's suppose that someone is turning 65 this month and they're going to go on Medicare. And so what happens is they enroll into Medicare A and Medicare B. So in this scenario here, this would have been someone whose birthday was 4/30/1959. They're eligible for Medicare at 65. And so if they begin at first eligibility, they would have an A date of 4/1/2024 and they have a B date of 4/1/2024. Okay, and so what we're saying is this birthday rule does not apply when we first go on Medicare, and here's why. Because everyone, and this applies to all 50 states as well as the District of Columbia, we have what is called a Medigap open enrollment period. Okay, and this Medigap open enrollment period is actually tied to the B date of Medicare. Now, in my example, we're saying we're starting A and B at the same time. Some people don't. They may go on A only, work for a couple more years, and then pick up Medicare B. But whenever we have Medicare B now, we're in this Medigap open enrollment period, and this period of time only lasts for 6 months. Okay, 6 months. And again, it's tied to the B date. So what happens is this. If I want to get a Medigap supplemental policy, I can actually apply for my Medigap policy. I can apply in most states in the range of about 3 to 6 months in advance. Now, my Med Sup plan is not going to start until my B actually goes into effect, but I don't have to wait for my B date to be able to apply for a plan. I can do it in advance. Again, 3 to 6 months. But the Medigap open enrollment period, this 6 months, means that once we started B, we actually have an additional 6 months where we can get any Medigap policy that is available in our state. And during that period of time, there's no medical underwriting at all. The insurance company has to approve and issue your MedSup policy, regardless of any pre-existing conditions, regardless really of any health conditions. They have to approve the policy. But again, it's tied to this B date. So the 6 months in this example would end when? So we have all of April, May, June, July, August, September. All right, so that just simply means that any time in my example of October 1, 2024, my Medigap open enrollment period is now over, the 6 months has expired, and moving forward, the only way in some states now that I can get a Medigap policy is to go through medical underwriting. Okay, so what I'm trying to teach you is there's no medical underwriting during the Medigap OEP period. Again, we apply 3 to 6 months in advance, and then 6 months after our B date, we're still in that period of time, which in some states is a once-in-a-lifetime opportunity. Okay, and so again, no underwriting whatsoever. But after this date here, then I'm going to have to go through underwriting if I want to get a Medigap policy, except in states where they have this birthday rule. So let me explain now how the birthday rule works. All right, so you can see the title of my slide here, birthday rule can apply when we what? When we want to switch supplemental plans. And notice the big word here, can apply, because you're going to see here in a few minutes there are some states where the birthday rule is not applicable, just not available in those states. But there are some states, actually 16 of them, where we actually can use the birthday rule and we can switch supplemental plans, meaning we can move from an F to a G or a G to an N. In other words, we can make a plan switch, or we can also sometimes even make a carrier switch. We may be with XYZ insurance company and we want to move to ABC insurance company. And so the point is, that's what the birthday rule is all about. So we already own a Medicare supplemental plan because we bought that 6 months prior to or 6 months after our B date where there's no underwriting, and now we want to switch plans or carriers. All right, so let me show you how it works. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, the first thing I want to draw your attention to would be 8 states that specifically call this switching opportunity a birthday rule state. There's actually 8 of them. Now I'm going to list the first 6 because all of these 6 are very, very similar, and the other 2 just a little bit different. But notice what we're looking at here. State of California, Oregon, Idaho, Nevada, Oklahoma, and Maryland. And again, all these states are tying this switching opportunity to your date of birth. But you're going to notice, for instance, in the state of California, we have our date of birth. See this kind of right there, right there, right there. Right there and right there. So in California, we actually can exercise this right to switch plans 30 days before date of birth and then 60 days after. So we actually got this 90-day window. But notice what's happening in the state of California. I own a MedSup plan right around my birthday, 30 days before, 60 days after. I can change plans like to like, or we would say an equal plan. So I could be on a G plan, I can go to another G plan, or I could be on a G plan and I can go down in coverage. I actually can have an N plan. If someone's on an F plan, they can go F to F, they could go F to G or F to N. So again, it's like to less, and notice here, any carrier that's offering coverage in my state. So again, a very, very broad rule in the state of California. Okay, you will notice in Oregon, it's date of birth then for the next 31 days. Again, same thing, like to less. Any carrier, in fact, you're going to notice all of these are like to less. Okay, can't move up in benefit, but I can stay the same or have a small reduction in benefit. You'll see Idaho, date of birth plus 63, Nevada's date of birth plus 61, Oklahoma date of birth plus 60, and then state of Maryland date of birth plus 31. Days beyond that. All right, so those 6 very similar, and then we have 2 states, again, birthday rule, just a little bit of different rule we have here, state of Louisiana and the state of Illinois. Now notice in Louisiana, again, 30 days before date of birth, 60 days after, so that same 90-day window, but what's different? Well, like to like is the same, like to like or like to less, but notice we have to stay with the same insurance company. So if you're with Aetna or United Healthcare, you can only move to Aetna or United Healthcare. You cannot switch carriers unless, of course, you go through underwriting. So if we want to exercise this rule, same carrier, Illinois, same situation, 45 days after birthday, like to less, same carrier for sure, cannot change insurance companies, but also one additional rule, I can only make this move without underwriting between the ages of 65 and 75. So if I'm 76, 78, 80, I want to make a switch, I can do so, but again, we're going through underwriting. All right, so those are those 8 specific states. Then we have 8 more that have some kind of unique rules. Let me share those with you real quickly. All right, so these states here specifically, I want to kind of break these 8 down because there are some similarities, but also a few differences. So the state of Washington and the state of Maine, notice what's happened. It's not tied to the birth date. This actually is a year-round opportunity, so you can exercise this at any time. And again, very similar to the other states in that it's like to like or like to less. And notice I can also do any carrier. So again, just a little bit more liberal rules for people to make the switch in these 2 states. Now, let's look at Kentucky. Kentucky actually just initiated this in January of this year. They approved it legislatively in 2023, but it began January 1, 2024. Again, very similar to the birthday rule, and that's tied to the date of birth, and we have an additional 60 days beyond that to make the switch. But notice the difference. It is just like to like, meaning if you're on a G plan, you can go to another company's G plan, but you can't do a G to an N without underwriting. So again, like to like. We cannot go up, we cannot go down, have to stay with the same letter that you have with your Medicare Supplemental Plan. And again, any carrier would have to approve you with no underwriting. Now, state of Missouri, similar, but they call it something differently. Missouri calls this the anniversary rule. So we can switch without underwriting, but it's not going to be tied to our date of birth. They tie it to the actual anniversary of the policy. So let's say someone starts a policy tomorrow. Let's call call it 5/1 of 2024. Then 5/1 of 2025 would be their anniversary. And if they live in the state of Missouri with no underwriting, they can switch plans. Well, what's the period of time? Notice 30 days before. So in my example, if I have a 5/1/2025 anniversary date, I could do this in April, and I can also do it then 30 days after, which in my example would be the month of May. So a 60-day window, 30 days before anniversary and 30 days after. And notice though, can't go less, can't move from a G to an N or an F to a G. I have to stay with the same plan type, and again, I have any carrier as an option for me. Okay, so that's the Missouri anniversary rule. All right, we have 4 more states that have similar rules, and you'll note they are New York, Connecticut, Vermont, and Massachusetts. Okay. And so what's unique about these particular companies, these particular states, is these are year-round opportunities. So we're not tied to a date of birth. We're not tied to an anniversary date. This is something that is an opportunity, just throughout the year. So you don't have to worry about it. You can make this switch. And you're also going to notice that every one of these states, any plan that you want to choose, meaning we're not bound to the like to less rule. You can select any plan that's sold in your state. Okay, so any plan and any carrier would also have to approve you. Now, I do want to mention something that is unique about this. The state of Vermont used to have a rule, and I think they have changed this, but I want to clarify. They used to actually restrict this carrier to United Healthcare as well as Mutual of Omaha. And again, I stay up to date on my research, and so it looks like they may have dropped that rule. I couldn't find anywhere where that still exists, but I just want to clarify that. I do believe it's any carrier. Again, it used to be just Mutual of Omaha and United Healthcare, so I need to do some further research on that, but that's where it stands as of today. So again, we have these states where year-round opportunity, any plan and any carrier. Okay, let's close out with this. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes. All right, so that's for 16 of the states. We have birthday rules, opportunities to make those switches, no underwriting. So I'm going to talk about now the other 34 states plus the District of Columbia. You can still make switches in these states, but the rules are different. Number one, you cannot switch without going through medical underwriting. All right, and so I want to make sure that you understand kind of there is an opportunity when you do that and the process that we have to follow. Okay, so first off, when we talk about switching and these other states, you can go with any letter that's available. Okay, you can go with any company that's available in your particular state, and notice this, you can do it at any time. Okay, and I really want to mention the any time because Medicare does have some open enrollment periods that do not apply to this kind of switching. Okay, we have one opportunity where people switch drug plans October 15th through December 7th. That is for prescription drug plans as well as Advantage plans. All right, so if someone has a Medicare Advantage plan or a drug plan, that's what those dates are for. We have another opportunity with Medicare Advantage plans all the way from January 1 through March 31st. Again, we can change those Medicare Advantage plans. All right, and so I mention these dates because though they're available, they apply to these kind of plans, not to getting a MedSup plan switch. So you're not bound to those dates, so I want to make sure you're clear on that. We can do this anytime. Now, the issue is, what's the process that's going to be involved in making a switch when we do not live in a state that has the birthday rules or something similar? Well, again, we're going to have to go through medical underwriting to do that. So let me explain how that works. We're going to ask you anywhere between about 30 to 35 different health questions. We are going to check all the medications you're taking to see what you're being treated for or you have maintenance meds for. And then we may have to, in rare cases, actually get a statement from your doctor explaining a certain health condition. So here's the point. We gather this information, and then what we're going to do, we're going to have to submit this to the insurance company's underwriting department. And now they're going to make a decision. Number one, they don't have to approve the case. Now, if we are in a birthday rule state, they have to, based upon those rules, but they don't have to if we're not in a birthday rule state. They have their discretion to say, yes, we'll approve the policy application, or no, we're not going to. All right, and so we're going to submit this information, and they're going to make the final decision. Now, I want to clarify something. For you to make this kind of switch, you do not have to be, ready to run a marathon and that kind of health. You just need to have generally good health. And so what happens is sometimes people's health will change. And so here's what they're looking at. They're going to look at some of the larger organs. They're going to look at your heart, your lungs, your liver, your kidney. They're going to ask you questions about diabetes, strokes, those kinds of things. And so people that can't get approved would be someone, let's say that you have in the last 24 months had a heart attack, or you had a stroke, or maybe you had a stent implant. One of those kinds of things, probably not going to get approved. Now, if it was 3 years ago, 5 years ago, no problem. Just usually within the last 24 months when in regard to some kind of a heart issue. If you have a lung issue, if you have COPD, not going to get to switch. Unless you're in a birthday rule state, right? But COPD is not going to go through underwriting. If someone has asthma, not a huge deal, as long as, again, it's not COPD. And so if there's something that's real serious, probably not going to get approved. So the liver, cirrhosis of the liver, you'd be declined. Some kind of liver disease, you're going to be declined for sure. Heart, lung, liver, kidney. So if we have any kind of serious kidney issue, such as kidney disease, renal failure, not going to get approved. Now, if you have kidney stones, that's not a declinable health condition. Painful, but it's not going to impact your application. If someone has had cancer in the last probably 36 months, probably not going to get approved. But if we've been cancer-free, treatment-free for more than 36 months, 5 years ago your cancer, or 10 years ago, probably is not going to be an issue. If you have AFib in your medical records and you're taking Xarelto or Eliquis, probably not going to get approved with that. So the point is there are certainly health conditions where they're going to be declinable, but again, if you don't have something major, we can probably get the case through. Now, I would encourage you, if you can answer no to all the health questions, it's well worth your time, your effort to be able to make application, because if the insurance company does not approve your case, there's no harm done. It's not like you're being blacklisted as though you can't try again in the future. It's not going to be held against you. All right, and so if you apply and you get denied, what's happened? You just simply keep the plan that you have right now. There's no cancellation or anything that's going to occur whatsoever. But if you can get approved and go through a medical underwriting, then it's well worth your time and effort, because you can probably save some substantial money as you reset the clock and restart that Medicare supplemental plan. Okay, and if that's something you want to do, we'd be delighted to assist you through the process. All right, so that's the way it's going to work in these other 34 states with no birthday rules.